Again, Philly, I gotta read it.
Yeah, make sure your mics are off kindly, please. All right, we got 10 seconds. Pick your best answer. Okay. Explained that they are qualified to prescribe medications, right? So that would be what we do. That is part of our scope, even though some of the scope, it is restricted, but that pretty much summarizes our scope of practice, right? And remember, yesterday we talked about the scope of practice and the standard. When we talk about the standard, we are talking about ANA, and that is national standard. Where you live and practice dictates what you can and cannot do. But in all states, you are allowed to prescribe medication. Now, that could be a restriction, what kind of medications you are allowed to prescribe, right? Some states may not allow you to prescribe classification 2, right? Maybe stimulants, for example. Most do, whether you are supervised or unsupervised. Okay. Remember about prescription authority and the scope of practice. Who dictates the scope of practice? That is important. I can almost guarantee you that at least one question, or if not more, will be either about the standard of practice or the scope of practice. In fact, way more than one, probably 3 or 4 questions for sure. Okay. So make sure you fully understand scope of practice and standard of practice. Okay, so adjustment of the current medication and continued monitoring, right? Why would that be possibly the best answer for this question?
Because she had the symptoms for 6 months. And
Exactly.
so,
Perfect. Amidula, she was the first. Absolutely, I love the answer. So there is a very difference between someone starting on an SSRI and having suicidal thoughts, right? So your action at that moment, usually the scenarios are like this. Someone starts on a SSRI and then returns to the office and they have suicidality or suicidal thoughts. Your action at that point is to stop the medication. Do not fall for such a question that asks, which of the following symptoms is usually explained to everyone or discussed with every patient that's most concerning for the patient? A lot of people will pick increase in suicidal risk. Usually that is not an answer. Obviously, that would be the answer if the scenario presents with someone that's 17 years old or younger than 23 years old. The number one concerning Side effect for SSRIs is sexual side effects. Okay, that is the most prominent side effect that we need to discuss with all patients. Now, in particularly for this scenario, if the medication was working and then it stopped working, then we need to reassess the reason why. And usually the answer is psychosocial, because the medication was working. Why did it stop working? So assessing for psychosocial distress, and if necessary, you could increase the medication. Okay.
Oops. Sorry.
Okay, so this is a hard question, right? Because one can definitely make the point to be respect autonomy and discontinue and provide education, right? So that is definitely a good answer. But you want to discuss, your job is a little bit more than just accept. You want to always respect the patient's autonomy, always respect the patient's autonomy. But you have to discuss the risks versus benefit and document, right? Uh, Rather than saying, hey, you have not had any mood symptoms for a while. I understand that you want to stop. Go ahead and stop it if you want to. I can't prevent you from stopping. But you want to discuss the risk versus benefit while still honoring autonomy, right? At the end, the patient makes their own decisions, but your job is to provide them with the risk benefits education so that they can make an informed decision. Okay? But very hard. It can be the A was very enticing.
Dr. Lopez, this is India, right? I just have a quick question.
I
How do
can't
I answer?
stop. I can't stop right now. Give me a second,
Oh, okay,
please.
no problem. No.
Okay. So autonomy, right? So remember, lots of question on ethical principles, lots of it. And sometimes it can be complicated because it will never be a simple, straightforward answer. So it's very important to understand the scenarios, because that's what's going to be like critical thinking, right? In this case, it's really dealing with the ethical dilemma in psychiatry, right? Navigating the treatment refusal in a patient while experiencing psychosis, right? So the core principle here is autonomy, to assess the components of that the patient has the moral absolutely moral and legal right of self-determination, which includes making choices about their own medical treatment, right? So remember, reigning versus claim in psychiatry, the law case that we discussed yesterday or the day before, that patients, even though they are involuntarily admitted, they can refuse the medication as long as they are not a risk to themselves or others. There was someone that had the question just before we started this question here. If you want to unmute yourself real quick and ask your question.
I'm
India.
sorry, Dr. Lopez. I'm just so confused. Like I'm attached to the presentation, but I don't know how to play the Calhoun where I can put my answers because I'm answering them like in my mind, and I'm like, how do I answer them on like to play?
So you can go to www.kahoot.it, not .com, .it.
Got
Once
it.
you go there, it's going to ask you for PIN code, which is 708712. And then you
Doc,
are going to create a nickname. Okay.
so I established all of that the last Calhoun that we did. Um, the last Kahoot we did. And so I don't know why, I don't know if I need to like look in the email for that link, but I definitely did it before. I was a part of the last Kahoot that we did.
Yeah, I can't help at this moment because I got to keep on
Okay,
going the game, but
no problem.
I'll
No problem.
definitely walk you through. Okay.
Okay, no problem.
You got to do it again.
Oh, okay. Okay. All right.
Yes. Very classic question. Okay. All right. So justice. This is one of the most classic questions. Okay. So it's justice all over, right? So justice really is a fair distribution of resources, usually whether it's medication, whether it's denying someone the opportunity to get a medication. This is a very, very classic question on justice. You know, it's is one of the things that this question, you should know it really well. Okay, so here it gives you the definition of justice, really is the distribution of appointments fairly among all the other patients. Okay. All right. Okay, so that's another classic, very classic question. It shows up in every board, whether it is withholding trazodone, withholding benzodiazepine, withholding stimulants. So anytime you are holding, you are not prescribing or doing something, because if you do, would be more harmful to the patient, you are applying the principle of non-maleficence, which is do no harm, right? So this patient had an adverse effect to benzo. If you prescribe it again, then it's going to be harmful to the patient. So you withhold the medication. Now, kind of changing the scenario a little bit. Let's say you have an older adult, right? And shows up in your office being anxious, and you prescribe an SSRI, right? Not a benzo, you prescribe an SSRI. But now the SSRI had the paradoxical effect, meaning instead of calming down the patient, it made the patient more anxious. So again, that scenario could be said that next time you do not prescribe SSRIs, and you are doing the same thing as non-maleficence, okay? Because it was harmful to the patient. Okay, so all right, so let's clear up a few things here. So contacting the state board to inquire about the temporary license, that doesn't work, okay? Now, if you are not licensed in a state, you advise the patient to go to the ED, if all possible, right? You do not practice if you are not licensed in the state, okay? And that is one of the main, now let's switch the question a little bit. What is one of the main problems with telehealth, right? Is exactly that. Well, one is HIPAA infringements that could happen more easily, but the second and bigger problem is extending the scope of practice. If I am practicing Florida, I cannot see a patient in New York, right? I mean, I can, I should not if I am not licensed in New York, right? So be careful. No matter what the scenario is, if you are not licensed in that state, do not prescribe, do not provide service. So what can you do? In an emergency case, obviously go to the ED or find the patient resources, right? That would be the right idea, okay? So let's say that you are practicing in your state and you see a patient in your state, and the patient now is traveling to New York and calls you and say, I ran out of medication. I need my medication. Can you send me my medication? The answer is no. If the patient and you are not within the borders of the state in which you have the scope of practice, do not send the medication to New York. What can you do? It's emergency. Let's say it's benzodiazepine. You know they need their benzos or SSRIs, otherwise they will have a serotonin discontinuation syndrome. Go to the nearest emergency department and get your medication refilled there, assessed by someone and prescribed in that, in that situation.
But Dr.
Hopefully
Lopez,
that, yes.
that's kind of a bad question because it says recommend the patient seek in-person care from a licensed provider in their state. So that's pretty much almost like you told them to go to the ER. So
Yeah.
what could be
So
different in this question to make you say, well, it's the cease providing, because it's pretty much almost the same thing, because you're not providing, you tell
yeah,
them to
so
go
just
someplace.
ceasing providing the therapy to the patient immediately due to the lack of licensure. That is the bottom line, right? Now, if it's not an emergency, they can find another provider, whatever they are, or they can go to the ED. Okay, so that's usually something has to do with the telehealth jurisdiction. Okay, so I see what you're saying. It's kind of like similar to before, but usually I'm giving you a scenario in which someone calls you and they are in another state and they run out of medication. Even though it's your patient and you see the patient all the time, the answer is go to the ED. Does it make sense a little bit?
It's kind of
Dr. Lopez,
the same.
Go ahead.
oh, I'm so sorry, guys. I didn't mean to overspeak. Um, I work in CPAP, which is New York City's like Psych ED, and that's literally what they do in practice. Like if the person is in Oregon and their patient was seen in Oregon, now they're in New York, the provider will say, "Hey, go to the CPAP, and I know you need your benzos." They have to do an evaluation on you and hopefully give you maybe a 10-day supply and then connect you to outpatient services. But I can't prescribe it to you because you're no longer being seen here in Oregon.
Yeah. And not to complicate things even more, about 10 days ago, I had to be admitted in Miami, and I arrived to my next station here, and they say, look, I didn't pick up my medication because otherwise I would have missed my flight 3 days later, right? And they sent it to me over here. I mean, I can't stop someone from doing that. I can always ask, but maybe someone in the hospital is licensed where I'm at now. But the reality is, if you're not licensed, you cannot prescribe in that state. Okay, that's the bottom line. So usually it's a phone call, someone, oh, I lost my medication, or I need my medication now. Then you advise them to go to the ED. That's usually the scenarios for the board. Okay, the question was a little iffy here for sure, and they could have need improved a little bit, but I think you guys got the gist of it, right?
Yeah. Hello, Dr. Lopez. Oh no, you started.
All right, so I think we got it here. It's trying to complicate things a little bit more by saying it's in another state. Now, there are cases in which you can break confidentiality, right? So specifically, risks to self or others, you can break confidentiality. And if you need to call authorities, the police, you can always do that. What else? When the risks when the benefit outweighs the risk. For example, if someone's passed out, they didn't give you consent, but the risk of not doing something or providing care, the benefits, you need to do what's best for the patient. What else? Children and elderly. What else? When the court says so, right? Sooner, when you, last one is insurance. Insurance is an important one. Medicaid, Medicare, you do not need consent, right? Because otherwise, how would they pay for the bill? Okay. All right. So why not? Well, let's start by saying that nothing psychiatry, nothing or almost nothing, it's absolute. Anytime you see strong words like absolute and unconditional, we know that's not true because we just discussed sometimes we have to break confidentiality, right? So just because of the strong words in the red or A option, we can almost clear that out completely, right? Now, have you guys noticed that the patient is, well, other than as the blue, right? So we want to respect the request, but advise them of legal limits to privacy, right? What if this patient, no, I don't want to complicate things. Just leave it at that. Right, amygdala is holding first place and she's not letting go, so that's a good thing. All right. Someone had a question just before we started the previous questions or no? Okay, let's keep on
I
moving.
have a question.
Go ahead.
Are all of the Kahoot questions from the Module 5 exam?
Most of them
Or are you
are.
kind of mixing them up?
They mostly are from Module 5. The Kahoot is
Okay.
done by my, by my team, but mostly are. Okay. Is there a
Okay,
specific
thank you.
question that you had or?
No, I'm just trying to figure out the best way to study. If I've already, done the questions then and read rationales, I was just trying to figure out the best way.
Yeah, so in the question bank, you have a supplemental questions. If you ever feel that you need a little extra, go scroll down, and then you can find the supplemental questions. That would be maybe another 150 questions if you feel that you need a little extra help or assistance in any of the modules. Okay.
Okay, thank you.
Mm-hmm. All right, so this is a kind of like a, unfortunately, not a good question, right? So usually you would not necessarily contact the neighbor, right? But here didn't give you a good option, such as calling the State Board of Nursing to discuss your scope or calling the police. So pretty much it kind of force you to pick exactly what the Tarasoff principle applies. Okay, so that's why it was not a good question. My team kind of like transcribed those questions and put in a Kahoot here. But in this scenario, if you are not giving any other sensible choice, then that's the best option. But when it comes to Tarasoff principle, as we discussed, the two best options, calling the police or calling the State Board of Nursing. And again, why would the State Board of Nursing possibly be a good answer? Because they define your scope of practice, what you can and cannot do, right? Now, if the question had stated, for example, that you know your state regulation and it is applicable, the Tarasoff principle, then this would have been an excellent answer, okay? Mm. Okay, so I think the trick on this question, I took a picture here. So while reviewing research or reviewing research articles, the PMHNP come across a study that suggests that undergoes rigorous peer review, including a large sample size, and deploys a double-blind, placebo-controlled trials. So what is the most appropriate level of evidence for this study to the hierarchies of evidence-based practice, right? So the definition of the question wasn't very clear because it was just borderline between um, one, which is meta-analysis and systemic review, and a double-blind controlled study, right? So usually what the meta-analysis and the systemic review is a combination of research studies that scientists put all together to come up with one level of evidence, right? So this one is pretty much a very close tie between 1 and 2, but in order to make it a fully level 1, we would need more studies to come up with one recommendation. Okay, even though it's double blind, placebo, and all that's being applied. Okay, just want to make the clarification because the question should have added a little bit more. For example, come up again, came across 3 double blind research studies and they come up with one evidence. So now we're talking about systemic or meta-analysis. Okay. All right, we got 8 seconds. Pick your best answer. Okay, so it's very tempting to pick the blue, right? So the blue is a statistical analysis, but you only get a good statistical analysis according to, you can get a high statistical analysis, but if you had bad methodology, then it doesn't mean much, right? So the quality and strength of the research design and methodology is actually the cornerstone for a good research study. Achieving a high, or in this case, low number, meaning let's say it is less than 0.05, meaning that 95% chances of what they found to be in the research is exactly what they thought it would be. But all that depends on the methodology, the number of participants, whether they use, whether the research can be generalized to the population as well, right? So it boils down to the quality and strength of the research design and methodology. That is what makes it a good research study. So it's important because then we can look at the, for example, we can look at the strengths of the research, that the statistical analysis, and don't get fooled by it, right? Because if we look and be like, oh, that was only 10 participants, well, that's not a good number. So therefore, the whole research is may not be very valid. All right, we got 10 seconds. All right, this one was fairly easy, right? So you don't rely on standards treatment used by a colleague. So that is a good fallacy because the board wants to see that you don't go with the flow, that you actually seek the answers. And where do you seek? With clinical guidelines, right? Evidence-based clinical guidelines is what should drive your treatment. If you look at Maslow's hierarchy of need, the least valid is the expert opinion, right? The top of the pyramid, then we have the highest levels of research, whether systemic review or meta-analysis. So they really are going to ask you questions like that, which is a good thing. All we need to do is understand Maslow's, hierarchy. So sorry, not Maslow's, hierarchies of evidence. Sorry, I was confusing the triangle. And then we kind of can get all these questions correct, not Maslow's. My apologies.
Dr. Lopez.
Yeah, I can't stop it right now.
Yeah, it's okay.
Like,
It's okay.
give me a second. All right, so that's pretty extremely easy, I would say. We got 100%. That's always awesome. Yeah. So we know this is a cultural question when we see someone from Mexico, someone from Brazil, Asian, Zimbabwe. What do? We provide culturally sensitive answers. That is simple as that. So that's glad that everyone got it. So I just received an email, another student passed, Kimi Tope. Lots of students passing today, so that's always a blessing, right? Yep.
Oh,
Oh, sorry. My apologies on that. All right, so this question, well, congratulations, Andy. You just passed the board today. It is always nice to have folks that are doing well. They come in and cheering on for you guys. So would love just to speak with you a little bit, Andy, at the end if you can hang. I know I don't want to stop the game in the middle, but I would love to see your experience and if you felt that you were prepared or if you have any advice for the other students. So please hang in there. My apologies there. Someone had a quick question before I started. Someone was trying to ask me a question.
I know for me, Dr. Lopez, there was two questions before, and it said partially correct, and I was like, but it was the right answer. So what does partially correct mean?
I honestly can't remember what question is that. I can try to go back at the end, but I would have to restart the game and click forward.
No problem.
It could have been my team has to put these up for me, so I'm not entirely sure what was the correct answer there that you are referring to at least.
Dr. Lopez, I think it was a question about the research.
Was the other,
Because I got
it
the
was the
same
other
answer.
question.
Question about the research.
Yes.
I'll go back
One of
to
the
it.
questions, one of the
Mhm.
questions said it had multiple answers on my.
Oh, really?
Yeah. So if you didn't pick, I guess, the two answers that they wanted, your answer was wrong.
No, it's keyed in incorrectly. So my apologies on that. These games are very complicated sometimes. They take a while to, it keeps changing the answer when they are entering the answer. Definitely keyed incorrectly because there is no partial correct answer. Okay. So assess for the condition and explore restrictions option. So this is a good question because we talked about the patient's three rights, right? One is confidentiality. Second, least
Restrictive
restrictive
environment.
environment. And the third,
And from consent.
consent.
Yeah, consent.
Right? Consent. And oftentimes they will mix consent and confidentiality terminology. Okay, so we have to know them very well. And we need to know that despite of the diagnosis of schizophrenia or Alzheimer's, a patient can give consent as long as they know the risk versus the benefit, they understand it's voluntarily, and they have full awareness during the consent that they can give consent. So the board will try to fool you by saying, can a schizophrenia patient give consent? Well, it can if the person is lucid and understands what's giving consent to, right?
Dr. Lopez, can I ask a quick question?
Once the time runs out, yes.
Okay, thank you.
Mm-hmm. Good. So we talked about policy making yesterday, and we talked about formulating, implementing, and evaluating after the implementation, right? FIE. All right. What was your question there, my dear?
Yeah, can somebody who's psychotic, someone who's delusional, can they consent?
No.
Okay, thank you.
Yeah, absolutely not. So the trick is, can someone with dementia give consent? Well, it depends, right? How advanced is the dementia? Is the person currently unable, doesn't have, understanding of the reality? Then obviously they cannot. Let's say I cannot give consent if I'm going through anesthesia and I'm dozing off and I don't have full, clarity of what I'm doing, so I cannot give consent. In order to give consent, you have to have understanding of what you're giving consent. Okay. All right. Yes. So in order to advocate, you don't have to necessarily write a specific bill, but you advocate if the bill supports mental health issues, right? Now, when it comes to advocating, the board loves that you select joining larger organizations, right? So if you are part of some memberships right now, you probably are getting a lot of emails at this moment, probably every week, if not more often, if not every other day, about supporting uh, the nurses' budget so that education grant can be provided, right? So there is a very strong lobbying at the moment for that. So how do you support the organs? How you support the profession? Oftentimes, times on questions is related to joining large organizations. Okay, be on the watch out for these types of questions.
Dr. Lopez, oh, I have a question.
Oops. I'll come back to that in a second. All right, so we're kind of getting, there was a quick question. Someone had the question.
I had a question. It
Go
was
ahead.
regarding to the duty to warn. So in that question, we were supposed to call the police, but in the practice questions, I put call the police and it was wrong. I was supposed to warn the father. So how do I know when it's which one? Because
So it really depends on the question, right? So generally speaking, two answers: calling the police or calling the state board of nursing. I hate that answer, but that could be an answer. Now, the question can be said according to the Tarasov principle, right? So basically, it's asking you, what is that? Or it could go in a way such that says the duty to warn principle is applicable in your state. Basically, now you're switching the whole understanding of what you do. So there is no 100% it's going to work for every question. But if you keep the time, the understanding that the majority of them, because you might get more than one, you can do it. You have to think that the board is national. It can not only be valid in New York or California, it has to be valid in all states. And warning the victim is not valid or supported in every single state.
Okay, if it's a priority question, would it be, because I think that's what it was, would it be call the father, then call the police? Like that, because it didn't say that, it was just like, what's the most prudent and legally required action?
Yeah, so I would have to look at the question carefully, because the whole question, the whole answer can change in a blink of an eye, depending how it's written. And sometimes the smallest details is what's going to make a difference on the question, okay? All right, 9 seconds. Yes, before, you have to conduct an assessment needs in the community in order to move it forward, in order to provide to state that there is a need for it, right? So I think that's pretty easy. Let's move on. The blue option is the same thing that we kind of mentioned a few times yesterday. Oftentimes, reporting your colleagues to the board of nursing or to the hospital administrator, these are usually incorrect answer. When we're looking at just culture, it's not a blaming, it is a way of fixing the system, right? Looking at the system as a whole and seeing if those actions were because someone's cutting corners or the system is failing the stuff, right? So it's always looking at the system first and then later the individual. Okay, so that is just culture. I guarantee you, you get a question just culture because it is an ANA statement, right? If you want to know what's going to be on a board, go look for all ANA statements. You know, what do they say about safety contract? What do they say about no safety contract, right? What do they say about just culture? Those are very classic because the board is about the standard of care. And who writes the standard of care? ANA, that kind of brings down to all the other organization. Okay. If you're not able to log in, I'm not entirely sure why I can't help in that. Sorry. All right, 5 seconds. Yes, so we have to gather more inputs on what is the problem in order to after that look for the research and provide some improvement. Anytime you see quality improvement, always think about retrospective chart review or PDSA, right? When you choose retrospective chart review when you're trying to identify the problem. You select PDSA when you're implementing changes, right? You're implementing the changes, and then you do the cycle that we covered yesterday from the beginning to the end, and you reanalyze and you do it again until there is some improvements, with considerable improvements, right? All right, so instead of saying retrospective chart review, we just kind of switch the wording here, right? Implementing the regular audit process and provide feedback. So that is retrospective chart review, right? If you remember, quality improvement, retrospective chart review, and PDSA. These are very common topics for the board. Very, very common, okay? Okay, I think that's pretty easy. If we find a problem, we have to share with others and then collect their feedback first, right? So, and then after that, we can do a policy and procedure to make that be the standard of care, right? Or a training session. But first, we have to disseminate the information in order to gather feedback on the stuff perspective of the problem.
You can't go back and change your answer, huh?
No, we cannot. Very hard question, right? Because how can you gather data if you don't know what you're looking for? So you identify the problem, you implement the changes, and then monitor the outcomes, and you gather the data again. So that is PDSA in disguise, one can say, right? But I can see that the blue is very, very appealing as well. You know, you can almost convince yourself, even if we say, okay, I'm gathering the data, I'll find out what is the problem, change the workflow, but where is the, you know, kind of like the redo process, kind of like gathering the data again to see if it works, right? But first, before you gather any data, you kind of need to know what you're looking for. So you need to identify what is the problem, and then you start looking to gather data for that, right? So that is the PDSA in disguise, right? So basically looking for the flow, gathering data, and then reevaluating again until the system is improved.
Dr. Lopez, I got this right, but it's just so weird that at
It
the
is.
end, at the end before you gather data, it's
Mhm.
just so weird. I mean,
It is. These are difficult questions because it doesn't allow a lot of characters for a full answer. So sometimes you have to be, very creative to make those answers. Okay. So this one, you found the problem, right? And then you are going to implement the change, right? So how would you do the implementation? you have to do the PDSA, which is exactly what it's doing. It's conducting a small run trial for the possible change within the group, so the problem that you are selecting. Okay, so this one is kind of, again, a bit hard, but if you stop and think, say, okay, we found the problem, now we are going to implement the change. Instead of making implementation hospital wide, you do a small batch to see if the implementation would make a difference. Okay. And they kind of give it a little bit of a rationale for the blue, the red, and the yellow here. Five seconds. Pick your best answer and go. All right, so basically what is the study is analysis of the results, right? So we're looking at the P for the plan. So it's the initial change, identifying the problem. When you have identifying the problem on a small scale, and the do is doing the work to carry out the plan in small scales, and the study is really analysis of the results, looking at the outcomes, and then the act is when we decide to what is the next batch of improvement. What are we going to change this time? Since we've done a whole cycle of PDSA, now we can do another batch with the improvements according to what we find out that didn't work the last time, or didn't work as well last time. And that process continues on and on and on until is satisfied that, you know, that the process is working better than compared to what it was before. Okay. All right. So if we look at A and D, they pretty much very closely related, right? So when we do cultural care, is anything but standard care, right? Now it's true that using an interpreter, it is supporting culture. However, what we want to do for every time, we want to always look at the research, evidence-based practice, and look at the patient's preference, right? Incorporating cultural assessment, beliefs, and practice, what is important for the patient, right? For their culture. So, best answer. Yes. All right, 10 seconds. All right, so 100%. That is always awesome. So we want to always validate the patient's experience. We give an example of a Puerto Rican syndrome with somatic symptoms. We want to validate what they're feeling. After all, that is the reason why they're here, right? To instead of saying, I think you are exaggerating, you want to validate their symptoms and understand what they're going through from their own context, right? Right, 5 seconds. Pick your best answer. And go. Okay. So again, cultural question. We want to validate and understand what they're going through. And definitely don't use standardized care, right? Or don't give them a diagnosis of depression or anxiety, right? Interpreting what they're going through, or asking for understand, help me understand what are you going through. In the case of mal de ojo, oftentimes it's a mother that comes in with a child and may have a red bracelet as a way to protect the child. So asking, perhaps saying, help me understand how does this bracelet protects your child. That is cultural care in this scenario. Right, last question of the day. All right. Worded weirdly, but we want to understand what they're going through and be sensitive to what it means to the patient. Now, if the patient wants to be admitted to the hospital with a healing stick, specifically for Native American, would that be okay?
Yes.
Yes, right? Even though it's a stick, so important to know that. All right, so third place, righty, nice sunshiny, and first place for today is. All right, let's go. Great name. So boom, then you have a Daisy, and I missed the last person. So great job, everyone. It has been a very long week. We've just finished the crash course review, and we jumped right into the module 5. As you can see, module 5, it is hard because it's very elusive, but please understand policy making, understand cultural care, and doing lots of practice. The scenario just changes names and flavors, but it kind of remains almost steady on the content. Okay, so good job and everyone for being here today. We'll go ahead and answer a few questions, something that's in your mind, before we call it off for the for the rest of the day. But let's start off with Andy. Andy, go ahead. I know you just passed the board, so that is exciting. If you want to unmute yourself and say a few things, that would be awesome. I got kicked out. 1 second. You are muted, Andy. I'm not sure if you can unmute yourself.
It's Addie.
Oh, Eddie. Sorry. Go ahead. Sorry, 1 second, please. Let me see. My computer froze on me, so. Here we go. Boom. Now I'm able to. Okay, better now. All right, Eddie. Hi. So, how was the experience for you? You're muted though. Are you there? Okay, I'm not sure if she's there. Joseph, do you have your hand up?
You're fine, Dr. Lopez.
Good. All right. Eddie, are you there? You're muted. I know some people got kicked out of today's event. It was a little bit so, but I'm not sure if you can unmute yourself. There is a mic here towards the bottom of the screen. If you want to give it a shout out, you can. Tega. Okay.
Yes, Dr. Lopez, was this recorded? Will it be on YouTube?
Yeah, it will be on YouTube, this one. Yes, it will be on YouTube.
Okay.
But I would suggest that because you have those questions in the question bank, rather than passively watching the YouTube is for the folks that don't have the question bank, so they can use the Kahoot to help them out. But probably best you get the question bank that you get the full answer and an explanation.
Okay, I didn't know it was on the Module 5 exam. That's perfect. Thank you.
Yeah. Caitlin.
Hello.
Hi.
Do you mind just really quick going over the percentage of each module again, just so that I can have it in one place?
Yeah. So let me go over here. Give me a second. So most of questions will come from module 2, right? Or domain 2. So let me kind of bring it up the blueprint real quick. The least important is psychotherapy. I believe it's only 17 questions, something like that. Let me kind of bring that up. When folks say, well, you know, I'm having trouble in psychotherapy, it is a good thing, generally speaking, right? Because
Oh,
if you,
Dr. Lopez, did you call me?
I did, yes.
Oh, I'm so
Go ahead.
sorry. I,
Yes, I
I
don't
was
know if
on the
you're still
phone.
there. Oh, okay, okay. Go ahead. Give us a shout out. Give us some good input. How was your preparation, and what do you do to succeed?
Oh, okay. First of all, I want to say Dr. Lopez is the high yield. Dr. Lopez is the GOAT. Oh, Dr.
Oh my
Lopez.
God.
Oh, I just want to thank you. You're a blessing from the sky. The short
Thank
period
you.
that I had with you, I learned so much. I learned so much, and I'm going to take this beyond and beyond and beyond. And I just want to tell everybody that focus and you will get this. I mean, the content, what he is teaching is the real deal. I took my green check with me when I walked into that hall today in Baltimore. I knew I had it. I had Dr. Lopez written all over my forehead because I knew that whoever I was taking this class from is the bomb. So
Thank you.
I just want, yes, Dr. Lopez, you are a blessing from the sky. And I just want to say thank you to you and your team. You make us proud. You make your students proud. And you're sending us a long way to be good practitioners. Learn the contents. They come from every angle. I just want to tell you, crash course, all your modules, all diagnostic tests, take them. Follow everything that Dr. Lopez is saying to do. Follow each one of them. I sat in the last crash course that just happened this past weekend.
Right.
And I made sure, yes. And I made sure that I listened to the core. I wrote down each summarized thing that I did not know. And I sat down and I went over everything. The crash courses, do not miss them. The diagnostic tests, do not miss them. When I did my diagnostic test, trust me, I didn't do well in one. Diagnostic test 2. That's the one I didn't have.
It's one of the hardest for sure.
Yes, that one was tough. I had a 78, but the rest of them I score above 80s, 85s, and 88s and 86. But I just want to say, if you don't know the content, trust me, you gotta know the content to pass this exam. It's not hard at all. Some of them are word to word to word to word. Some of them, they just change the words.
That's a little bit change, right?
Yes, just a little bit. But if you know the contents, boom. I was just clicking and clicking and clicking and clicking as I read the questions. And if you have your first answer, please don't change answers. If that's your instinct, don't change them. Don't go back. You can flag them, go back and reread them. Don't make it a habit to change answers.
Yes. Well, congratulations, Andy. That is, how long did you study for?
I joined your course in April. So I think in the middle of, oh no, towards the end of April. The first crash course that you had, yes, that's when I joined.
You joined right in the crash course.
Yes, but I didn't attend that crash course because I was right in that. Yeah, I didn't attend that crash course. So, but I attended this one.
Good, good.
Yes.
Well, congratulations and best luck on your next step. Just make sure that we'll follow up and send you the gift. Again, you're going to be very. I hope you're going to be very happy with your gifts. It's like it really is 500 pages of more in detail psychotherapy, medications, and few things that can help you in a fly to implement psychiatry, which you already now have, the minimum requirement to practice. So good luck. And I know in Baltimore, in Maryland, you can practice you can practice independently, I believe, right?
Yes.
So there are good hospitals there. John Hopkins. I worked at Walter Reed for almost 8 years. I practice in there's another hospital there that's a very good hospital. So
What,
good
NIH?
institutions. Yes, NIH. And there is another one in just before Baltimore. That is a psychiatric hospital. I kind of worked there as well a little bit. So lots of good places to work in the area. So yeah.
I think I also plan on joining the pharmacology
Yes.
that you offer. So
Yeah, it's now it's a different beast, right? So as you got this out of the way, the psychopharmacology course is excruciating detail. So now you can't just settle for kind of like, oh, I know the answer. Now you need to be extremely professional because you worked very hard to get here. Now you have to work hard to keep what you gain, right? And really doing well for people. So doing well for your patients. So congrats. I'm glad that things worked out the way it should for everyone. So congrats.
thank you. Thank you. Again, you are like the high heel. Everyone just listen. Please listen to Dr. Lopez. When he says no, 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 he means no, no, no. When he says yes, 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 he means yes, yes, yes.
Been doing this for over 6,000 times, right? So I think I have a pretty good idea what should be there and what should not.
Right.
But congrats, Andy. I appreciate you coming in and give us a shout out on your performance, which is always encouraging for the others that are going to test soon. So
Thank you.
great.
And
Yeah.
congrats to everybody that is waiting to pass as well.
Amen for that. All right. Racy, are you there? Racy Dream. Interesting name. Okay. Indy or India?
Oh yes, I in my mind I thought it's two Indias. Okay.
No, Dream.
Oh, Dream. So go ahead, Dream first, and then we'll go India first.
Hi,
After
Dr.
that.
Lopez.
Hello.
Thank you so much for all you do.
Absolutely, my
First
pleasure.
of all, I have a question in regards to one of the Kahoot questions you were talking about a patient going to another state and wanting his or her prescriptions transferred to the state. Because I do have someone that's that is into the practice, and such a question came up between the two of us, and she made sense to me. I don't know if it's the truth or not. The patient, okay, since the patient was in New York, however, this MP is treating the patient or is licensed in Baltimore, let's put it Baltimore. And the patient lives in Baltimore too. However, the patient now traveled to New York. Is it okay if, or probably I send the prescription to the patient's pharmacy here, maybe Walgreens, and the person will now call Walgreens over there in New York and have the medication transferred to him or her there?
So yes, it is.
Okay.
Right. But what Walgreens does or doesn't do, that's their dilemma, right? What you cannot do, especially, for the board, we cannot make up cases because things can get very hairy. So we got to look for what's obvious. There would never be a scenario like that. But you can. I'll prescribe to Walgreens in my state all day long. Now, what Walgreens does is what they do, and I don't know what kind of system they are utilizing to do so. Maybe it's allowed because maybe they have, whatever they do. As long as I am prescribing and attending to the patients where I am licensed, that is the only thing that I'm concerned. Now, how the patient is going to fly back and pick up their medication or find some other way to pick up their medication, that is okay. The problem is practicing, doing psychotherapy outside of the state of your scope. That is the only problem. Does that make sense?
It's not you, but the patient, or is it the both of you?
If the patient is outside the state in which I covered, right, I cannot. So I cannot practice if I am not licensed to. If the patient is in New York, Baltimore, and I am in Florida, I cannot practice there, right?
But what if the patient was your patient or is your patient in Florida and
Yeah.
travels?
So where is the patient? If the
Baltimore.
patient, so I do not have jurisdiction. I am not
Okay.
licensed. I am licensed in Maryland, but let's say if my license is Florida and the patient is outside my domain, the state of Florida, I cannot practice there.
Okay.
Okay.
That's question number
Yeah.
one. Thank you.
Yeah.
Question number two is I personally I do have a special accommodation, and most of your exams or tests are timed. For
Yeah.
those people that have anxiety, what do you do, or what do we have to do? Because it takes me, I can't get it under 1 minute.
Unfortunately, I don't think there is anything that's 1 minute. It's 2 minutes, but it's still, I see your point and I agree with you 100%. But I don't have a way to get on your name and separate the question. So unfortunately, it's one system for everyone. So I don't have a way to. In 2 minutes, it's more than. So I don't even have a ability to do 1 minute and 20 seconds. So if I do it for 1 minute, I'm cutting everyone short because it's 1 minute and 20 seconds per question. If I do 2 minutes, I'm giving a little bit more, and that is not good because I don't want. And again, I think it's only the crash course review question that is timed, I believe, and maybe the test. Right? I think I took the timing out of the test. I believe.
I've not started any one of them, but I just heard from my friend that when you start it, you can't stop.
Used to be true, which is not true now.
Oh, okay.
Yeah, it used to be true, but it's not true. But I think about that all the time because I think I'm not doing a good job for the people that needs to be tested on time. So it's kind of like a dilemma, right? But a lot of people say, well, I have to work. I can't do all 175 questions. So I think it's not a good practice to prepare in an environment that's different than what the reality is going to be. I think everyone should prepare in a similar environment because it is difficult to do a test in 3.5 hours. And if you don't practice, you don't want to find out the test day, right? So even though it doesn't have a timer, I highly, highly advise everyone to practice in less than 3.5 hours, and because you don't want to get there and find out. You want to know before your test date.
Yeah.
Okay. Alrighty. Thank you for the question there.
Thank you.
All right, India.
Hi, Dr. Lopez. Every time I get to
Hello.
speak to you, I feel like it's an honor. I just want to give you a compliment. My brain works backwards, and I keep hearing your voice. And I think module 4 about like doing it first to really understand, because therapy is my weak area, and I seen that in the diagnostic thing. So I really wanted to. I'm gonna go back to it, but I wanted it to be my first. I tried to do module 1, and I was like, listen, let's go to therapy. Like, understand this because it's a lot to know. So with that being said, I'm trying to learn how to work through the modules because I think the module 4 had 23 modules. And so I am big on like time. And so I'm trying to figure out in reality what it would look like per day or whatever days that I can study, to how many modules that you recommend finishing.
So, each module is about 5 hours. So whether is, well, not true, because module 2 has a little bit less. Module 5 is a little bit longer because there's a lot of therapies, right? So that seems to be that appears to be more difficult, and it is more difficult because we don't cover all the therapies in schools. Now, there is a sheet, a Microsoft Word for modules 4. After you have gone through the main videos, focus on that. Focus on that, like reading every day, specifically family therapy, structure therapy, multi-system therapy. If you can memorize 3 things for each one of those, you don't need more than that. You definitely don't need more than that. But you have to have a good understanding what they are.
Gotcha. Would I find the sheets in the module, like just
Yep.
like you have the PDF forms? Would I find
Yep.
the sheet there?
Same location. Now, be mindful that you're putting a lot of effort. I'm not saying you are, if you are, for the least amount of question, right? So where should everyone's effort be? Like non-stopping, modules 1, 2, and 3. Why? Because 33, 33, and 41, that's 107 questions, right? How many questions do you need to pass? 105. Right? And I'm not discounting psychotherapy. You should know, you should have a good understanding, but this is not where you should put your effort. You need to put your effort where the money is, which is modules 1, 2, and 3. Right? And then module 5, it's kind of like, oh, okay, now we kind of understand policy making. Now we understand that we don't pick warning the victim right away, unless if it's a specific question. We understand how to give culturally sensitive. This is pretty much a check. It's harder in the beginning, but then after a while, it becomes a check. Now, this is where we need to put all our focus on, where the money is, right? Modules 1, 2, and 3. Scientific foundation, advanced practice skills, and
For
diagnosis.
those two.
Yeah. So
Okay.
those 3
Who would
PDFs,
that be?
we need to be reading the PDFs consistently. I mean, instead of reading, we need to do active recall, meaning we look at the topic lithium and say, what do I remember about lithium? So forcing your brain to say it without seeing the content. Because if you are able to do that, you know the content. And don't expect it to say it all things during the PDF. Nobody can do that, right? You always need the prompt. But when you see it, like, oh, I knew that, I just couldn't necessarily say it. But as long as you're saying the majority of it, then you're good to go. All right. Did I answer your question there?
Yes. And I guess the other part of that question was, you said it's about 5 hours. Because what I'm trying to do is I'm trying not to, I don't want to stretch it, but I'm really trying to follow the plan where like you start off at the beginning of the week, whatever days you're off or whatever time you have available, and watch a few videos. It's like I don't want to cram 3 hours of videos in just to be done. I really want to, I write things down and I try to process it. So I'm like, do you recommend maybe 3 videos a day or
It depends, right? Because the majority of videos, I would say the greater majority, there are some that are not that way. It might be 10 minutes. You know, we have videos that are 5, and we may have one that is 20 minutes. So we do micro learning. So instead of saying 3 videos, 2 hours a day, you should be able, 2 hours a day, you should be able to complete all the videos in the one module and complete all the question bank for the module. That's 12 hours. So 6 times 2, 12. So that is 12 hours a week. You should be able to cross everything. Now, you have to understand that you may not have 2 hours the day that you work. So therefore, you may have to do the days that you are off. You may have to do 3 hours.
Gotcha.
You know, what I did when I studied for the board, I would tell myself, eat the frog first thing in the morning. So get up early, do your question bank, because I know damn well that when I'm coming back from work, I'm going to be tired. I'm not going to be studying, right? Or if I don't study, I'll feel guilt. But if I study, I don't retain. So I wake up at 4 o'clock in the morning and knock it out maybe 2 or 3 hours of question. And then when they come home, then I can say, okay, maybe I'll study, maybe I don't. And the days that I'm off, I'm definitely studying, right? So you have to make it up the days that you are working by waking up early. Now, don't let your mood dictate what you do or don't do. If you don't want to study anyways, right? Because this is like one of the things that there is no expectation other than, okay, I expect it, but other than yourself is the main expectation. They're not going to take your degree away if you don't test it. But the longer you delay, the worse it is. So today, I don't know if she's here. I got an email that I told this person, said, look, you are at risk of not passing. Why, Dr. Lopez? Why would that be? It's like, look, you've been in the course for 6 months. What is going on? And she's like, she passed today. She said, you read you prophesized that I was at risk. So I took the courage and took the test and I passed. So that is a great thing, right? So all these folks, they kind of like pass today. And I mean, it's a lot of people passing the board, right? So let me share my email with you. Hopefully I'm not sharing no big information here because everyone's really passed. So
My friend that brought me also passed today.
What's her name?
Eva,
right? So I don't know if I have a Eva. Christina, Andy, Vigi, Justina, Louise, some people are not, love at. And there are so many more that I didn't even get to open my email today.
I
So,
passed today too.
oh, hold on, let me see who it is because I don't see who is that.
It's
Oh,
Chichi.
Chichi,
Yes,
hi.
sir.
How are you?
I'm good, sir. I took the test and I passed.
All
Yay.
right. Do you feel confident? Oh,
Oh, yes, yes. I mean, I was getting up to 95 on the diagnostic test, and you said if you get over 85,
80. I'm
80?
comfortable. I'm comfortable. You guys testing on 80%. Now,
Yeah.
it cannot be like 80% the second time. Then I really don't know. But 80% of my tests on all
Mm.
4 of them, it is easier for you to hit the lotto than not pass. Because imagine this: each test is 170 questions, right? 75 questions for me. Sometimes we got 75. So maybe 1 or 2 I have 160. Let's call it 170. The probability, I like math. So the probability of hitting 80% 4 times in 170 per test, it is easier for you to hit the lotto than it is to hit 80% and not know the content. Now,
Yeah.
the second time, I don't know. Don't ask me if you are going to pass because I don't know. Because now you memorize the answer and you got 100. I can't help you at that point. So that's right. That's why I emphasize when you take the diagnostic test, that is the truth. It is your final for your course, for example, for your class. There is no coming back from there. It is what it is. Now you know the answers. I can't say it. I can't really say it with confidence. And I don't say good things if I don't mean it. I just have to say the truth because I want to make you aware that may not be the good time to test. And I have to tell some people and say, look, I don't think it's a good time. I would rethink about taking this test now because I see the score. And some people say, oh, I don't have a choice. It's my last day. So if that is the true, then we can just go with the flow, but knowing very well that you're not in a good spot to test. And usually happens. Very few times somebody proves me wrong. Very few times. But this is data, right? So it's not feeling, it's not like, oh, I think you're okay. This is just data, the bell curve, where 97% of the people fall in. Then we have the outliers, the 1.5 that do extremely well, and then we have the 1.5 that do extremely poor. But all of us fall, most of us, I would say, in that bell curve, 97%, right? Whether we're right in the middle, the top, or the outliers, still with the 97% if you score 80% on the 4 tests at the end of the course, right? Go ahead, Shishi.
Yeah, thank you so much, Dr. Lopez. I just wanted to say I'm grateful and everything you taught on the live crash course review. I was just I was just like I was hearing your voice in the exam hall, and I mean I'm so happy. It still
Yeah,
feels unreal.
yeah, like
Because I only did this for 2.5 weeks, and I know. I'm Congratulations.
yeah. Well,
Uh,
congratulations on that. People don't
Dr.
follow her. That is dangerous.
Don't
Okay,
follow
don't.
me, please. I almost died. I almost died. Don't do that. It's a wrong move. I do not recommend at all. I have not slept for how many days? That
I
is
had
so wrong.
I had
No.
somebody that passed, I think, a month ago. He said, Dr. Lopez, I got to tell you something. I only started with you for 1 day and they took my board and I passed. I'm like, oh my God, don't tell me that.
I
You,
know. Right.
you,
That
you
was
know,
wrong.
it's dangerous, but it works for some people, right? It doesn't work for the majority, I would say.
Yeah.
Um, yeah. Well, congrats. It's always awesome.
Thank
And,
you.
you achieved the success on to bigger and better things. So that's awesome.
Yeah, I did that because I'm already in school for my DMP, and
Okay.
yeah, so I had just 2 weeks to take it. I mean, 2 weeks off because I was waiting for them to do my IRB. So I said, let me just use the opportunity to, let me take my chances.
So you took the board before you graduated.
Before what?
You
I don't.
graduated.
No, no, I
No.
graduated in February. So
Oh, okay, okay,
immediately, yeah, immediately I started my DMP a week after.
okay.
I mean, 3 weeks after I started my DMP, so I have not had time to study for the board. Then I had these 2 weeks, so I took it, and it worked out. Thank God.
Yeah, you went all in. You dedicated 2 weeks
Yeah.
continuously too. So it is a little bit different, right?
Yes,
Because
sir.
you can actually do the whole course in 2 weeks because everything is recorded, everything is
Mhm.
available. So you don't have to wait, but it is a lot of content to cover in two
Yes.
weeks. And we have a lot of people that do DMPs and before they graduate, they already took the board, which is
Mhm.
possible. So congrats, Shishi.
Thank,
Nice.
thank you, thank you.
Alrighty. Paul, are you there? Bama? Bama?
Yes,
Hey there. How can I
yes,
help you?
hi. Yes, hi, Dr. Lopez.
Hi.
My question is pertaining to one of the questions we saw earlier tonight regarding non-maleficence. It was
Yeah.
regarding a young 28-year-old gentleman with diagnosis of generalized anxiety disorder, and I think I was distracted because I'm at work right now. I
Mm,
didn't exactly understand why non-maleficence was. I think it was also benzo, something about benzo. I don't.
right. Anybody recalls and wants to chime in why?
It's because I think the patient had the adverse reaction with the benzo before. And
Bingo. That
yeah,
is
it
the
would not
exactly
be
why.
safe to put the patient back on benzo.
Yep.
Okay.
So yeah, I read that question too, and I was like, oh, okay. And then the diverse fact, that is exactly why. Not so much because it's benzo and anxiety. Preferably, it's not the first line medication, right? It's the
Mm-hmm.
third line of medication. But it's
Mm-hmm.
not necessarily wrong either. It's just not the best solution. But for the specific case, it said adverse reaction to the benzo. Please give it to me. I need it because I'm so anxious. I'm having a panic attack. If you had an adverse reaction, then you cannot
In the
give it.
past, yeah. Mm-hmm.
Okay.
Okay, makes
All
sense.
righty.
All right, thank you.
Awesome. All right, folks. Anybody has